Hi, we're doing the Methodist Lebanon Healthcare IT Assessment by Dan, Matali, Kimberly, and Mark. On this slide, we'll talk about the overview of the IT assessment. First, we're going to talk about what is Methodist Lebanon. Then we'll talk about our vision, the overview of the IT assessment, enterprise applications, primary systems, enterprise apps, knowledge management decision support, application development methods, strategic investment in IT plan, people, social media presence, IT strategy, and lastly, overview assessment SWOT. So a little bit about Methodist Lebanon Healthcare. We have 6 hospitals and 117 locations serving 1.2 million lives. Our team, 2017 Fortune 100 Best Companies to Work For and Becker's 2015 to 2017 Great Places to Work in Healthcare. Lebanon's children earned Magnet designation in 2016. We have 13,501 associates, 2,303 providers, and 800 residents. 405,000 ED visits, 63,953 hospital admissions. Our revenue funds our mission to care for more uninsured in the state. This goes for 1,650 beds and $1.92 billion in revenue. We also have 600 congregations in the health network. Methodist vision. Information technology services will be recognized as a high-performance team offering technology excellence that enables our associates and physicians to provide easily accessible, high-quality, safe experiences that are responsive to consumer expectations and leverage innovation, clinical research in alignment with Methodist Lebanon Healthcare's mission and strategic priorities. In this slide, we'll talk about enterprise applications. Primary applications used to conduct the organization's primary business. For these two, we'll talk about the technology platform and integration firm. For technology platform, we'll talk about Cisco. The reason why we used it, because it's a national market leader. It consistently ranks highest in the industry surveys. It appears best positioned to survive, thrive in a consolidating industry. It is an industry leader in acquiring medical devices certifications. It has a significant installed base in the Memphis market, including healthcare, and has offered the most favorable equipment pricing positively validated by ECRI. For integration firm Presido, the reasons why we use that is a lending U.S. network engineer firm with a major Memphis presence. It is selected to partner with Johnson Controls on major projects. It's the largest healthcare partner in the U.S. and is favorably positioned to provide Cisco-trained engineers in this market. We are a ERP and we have vendors in EMR systems for clinics, Cerner for the hospitals, for all scripts, and for outpatient clinics. In this slide, we're gonna talk about primary systems. For our main system, we use DBMS. We imagine solutions for X-rays, SAP, NetApps, and SAN storage. We do use ERPs because it is our underlying foundation system. We also use SAP as our vendor partner. Currently, we are unclear if we use CRMs, but we might use it for marketing. In this slide, we'll talk about Program Management Office. The responsibilities is to create a comprehensive IT project and portfolio management service and support. This includes support to direct management of IT projects and operational or enterprise projects with a significant IT component, definition, maintenance, and application of standardized project management, methodology, tools, and processes, sharing and dissemination of project management knowledge throughout IT and across the enterprise, managing intake of new projects, vetting new apps and systems, and coordinating IT governance, providing comprehensive testing and system validation support, The PMO includes 7 project managers, a project analyst, and a testing coordinator.
Next, we talk about knowledge management and decision support. IT will enable the care of Methodist patients through deployment and ongoing optimization of an enterprise-wide EMR supporting improved and standard clinical care across all the venues of care to serve the needs of their patients and families. IT will support the patients and families with a technology infrastructure that enables rapid collection of usable data as well as enhanced communication with patients and families and streamlined clinical workflow. IT will support the coordination of strategic initiatives across the organization to assist in the oversight and alignment with key organizational priorities and value creation in conjunction with CFOs. It will seek ways to increase the efficiencies while reducing technology complexity. Knowledge management and decision support continued. IT will ensure a strong service-focused IT workforce capable of achieving the information technology goals of Methodist to drive efficiency, reduce duplication, and build the environment to deliver world-class care. IT will partner with HR to ensure that the Methodist process and technology support to provide a world-class workforce. It will leverage and support the Methodist research infrastructure in collaboration with LB, UTHSC, and University of Memphis. It will leverage the reliable and emerging technologies and information resources to focus on the experience of our physicians at MLH to provide the world-class care and real-time analytics and ease of workflow. Also, it will prepare for the most severe attacks and advance the cybersecurity and technology activities to more advanced stages of maturity using audits, staffing, metrics, disaster recovery, business continuity, and the world-class data and voice technologies and services. Next, we talk about the application development methods. If a solution or a vendor has been identified, then briefly describe the product or the vendor, including the solution name and version. If multiple solutions are being compared or vetted, include all candidates' characteristics of the solution. Brief description of the solutions, for example, including major functions and features, especially as they relate to the meeting, the clinical and the business needs. Then the platform, whether it's OS, ASP, cloud-based or Citrix. The browser compatibility, whether it's Internet Explorer or Chrome. Mobile device compatibility, whether it's iOS or Android. Then the major hardware requirements like servers, additional computers, etc. If considering multiple vendors or systems, use a table for a concise comparison. Ensure that the IT technical questionnaire has been completed and reviewed before submitting presentation and requesting time on TEC agenda. Applications were not made in-house, they are rented from the cloud for Methodist. Next, we talk about the strategic investments in IT. Here we see the 2017 System Deployment Map for Quality. They have divided it into strategic priority and goal. In this case, it is to pursue the population health strategies while preparing for risk. Next, we go to the sub-goal, which is the logical divisions of strategic goals. In this case, it would be continue making strategic investments in IT were proven to raise the quality, safety, or lower cost via efficiency in support of a regional system of care. Next, there are the annual goals, which are more specific and have measurable outcomes. For example, they have the issue of cybersecurity, regulatory infrastructure. Then there's operational efficiencies like charter metrics, or tell the patient story with a unified record with the help of enhanced provider experience, or complete the record, streamline EHR workflow, etc. Next, we move on to the projects and the initiatives, which are basically the key activities that support the annual cost. The main project would be to develop a comprehensive IT strategic plan, then to associate the access proving automation, and then hospital campuses. Lastly, they also have some project initiatives where they take in the update, the status update. So they have like polls or Macbeth, and this is a really effective way to go about the deployment map plan. Next, we talk about the IT plan. The first part of the slide presents the patient and family experience. So here the IT will support the patients and families with a technology infrastructure that enables rapid collection of usable data as well as enhanced communication with patients and families and streamlined clinical workflow. For the enablers of 2020, they have steps like evaluate and implement the bridge solution for enterprise-wide online patient bill pay and self-scheduling by 2019, then migrate to single EMR, PA or PM across the enterprise by 2020 for a mobile platform for integrated patient experience for integrated search, price estimation, and scheduling solutions, cost accounting systems, real-time patient feedback systems, care engagement, telehealth, and other systems and capabilities designed to improve the consumer experience and increase the consumer loyalty. So they have hospitals in that for 2018-19 plan, then Sutherland 2019. Next, they implement the tools for the patient-entered data and outcomes as well as leader rounding and enterprise-wide patient education. Then they implement the Enterprise Master Patient Index in 2018 for this center. The next part of the plan is the operational efficiency. So the IT will support the coordination of the strategic initiatives across the organization to assist in the oversight and alignment with key organizational priorities and value creation in conjunction with the CFOs. IT will seek ways to increase efficiencies while reducing the technology complexity. So in this case, the enablers for 2020 plan are continue to leverage the lean, agile, and ITIL to remove IT, operational waste, improve the efficiency and reliability. Next is to explore new technologies, virtualization, mobility, blockchain, and leverage as needed to liberate data, drive efficiency, and bring data into clinical and business workflow. Then support the high reliability with systems through redundancy and security improvements. Support the analytics roadmap with operational planning, leadership with enterprise-wide focus on data management. And lastly, leverage and continue to grow the project management maturity to continue to be the excellent stewards of resources aligned to provide reliable, sustainable, efficient IT-based tools for clinical and business needs.
The IT department has 250 software IT engineers locally. The Vice President of Information Technology is Jean Fernandez. The IT department also has an in-house call center of 16 employees. The call center responds to calls for all locations and all hospital staff members to resolve any technical issues. Methodist has an application available through Google Play Store for Androids and Apple App Store for Apple products. The app allows guests to view emergency room and minor med wait times. Using a map feature, the app also provides the quickest route to any Methodist emergency room. Finally, the message center within the app allows you to receive alerts, healthy lifestyle tips, and special offers. Social media presence is used on 3 platforms. Their Facebook page has 48,489 likes, their Instagram has 1,439 followers, and their Twitter has 4,693 followers. They don't rely heavily on social media, being that there are no goods and services exchanged via their accounts. For this reason, I noticed that they post 1 to 2 times a week with the same post across all of their social media platforms. However, each hospital location does have their own Facebook page.
All right, I'm going to be talking about IT strategy. Number one is they focus most on is patients first. Elevate the patient's experience, enhance consumer access, and adopt evidence-based practices. This is key for their business practices to make sure that patients get the best care possible, that they get the information as quick as possible and as accurate as possible. Second is people. Recruit, retain, develop people, strengthen physical alignment. Make sure they get the best people for the job and keep them, and develop their skills and their practices to make sure they have the best employees possible to deliver the best care possible. Next is one team. Deliver, coordinate care, elevate system thinking, and develop disciplined partnerships. It is key for them to develop key relationships with vendors and make sure that they have the best vendors possible so that they don't have any mistakes when delivering information about patients. Accuracy is key. Last is financial responsibility. Build cost, effectiveness, discipline, optimize payer strategies. This is key for reducing cost and making sure that the business stays afloat. For the IT department is to make sure their investments are wise and that they can keep costs down to deliver the most advanced technology at the best price. Okay, there's 7 guiding principles to Methodist IT strategy. Number 1, provide information critical to patient care that fosters safety throughout the continuum of care for all patients, providers, and associates. Number 2, acquire new information technology that focuses on consumer expectations for convenience and transparency and strengthens the financial visibility of all entities and provide a robust experience network infrastructure. This is key for the healthcare provider to provide a more intimate bond with the patient to let them know that they're doing the best they can and they truly care about them when they're in their time of need. Number 3, evaluate and select vendors on an organizational-wide basis to facilitate integration and management of patient financial and operational information with accuracy, appropriateness, accessibility, and timeliness. This is key for when they select vendors that they need to evaluate them, that they'll do their job right and as accurate as possible to make sure that patients are not in danger, to make sure that patients get the best care possible. Number 4, work towards a more unified, less complex, more cost-effective IT environment to provide our patients experience by selecting new and replacement systems that meet and exceed MLH's requirements for fewer companies. This is key for the IT department since they are so important to the flow of information and the timeliness and how doctors and how patients receive information, that it's key for them to always be on the lookout to find more cost-effective ways to become faster, more innovative, and make sure that they don't have as many companies and as vendors, is to cut down to have one unified system that makes it easier and a flow of information simpler. 7 guiding principles continued. Number 5, create and foster partnerships with affiliated and outside providers and entities to leverage technology to enhance care coordination affordably and optimize patient experiences in our service areas. Number 6, to practice all patient information, cybersecurity will be viewed from a holistic perspective as an enterprise-wide risk management opportunity. Cybersecurity at this point is a really key point for the hospital. Methodist has to take great strides in making sure that patients' information is secure and that it won't be hacked or stolen at any time. It's something they take very seriously and watch really carefully. Number 7, establish an ongoing process to update the IT strategic plan to ensure continual alignment with the organization's strategic goals and drive the successful achievement of expected outcomes. For this case, right now, one of the strategic plans that they're doing, and they've been doing since 2017, is making sure they cut down on the number of vendors they use. For right now, for the EMR system, their electronic medical records, they are using 3 separate vendors, one for the hospital, one for the hospital, one for clinical, and one for outpatient clinical. And their goal is to cut down on using 3 and unify into 1 to make it a much simpler system. IT strategy, supporting the organization's mission. Methodist Bonner's mission is from when a patient comes in and leaves, gets the best healthcare and service possible. The IT's mission is to provide the right information to the right person at the right time. This is critical to the implementation of the right healthcare plan to each patient at a critical timing. The presence of the IT department at Methodist is very large. The content can range from managing the electronic medical records or EMR systems to managing the Wi-Fi for medical equipment to digital security monitoring to customer follow-ups and feedback systems. The IT alignment with corporate strategy is that their job is to provide and maintain the flow of critical information to ensure that a patient receives the best service possible while also finding new ways of driving the cost down. The rest of the organization views the IT function as a vital piece of the overall business. IT is the driving force behind innovation for the healthcare industry, always looking for new ways to integrate the latest technology in the industry in a cost-effective way in order to save lives. Overall assessment, SWOT. Strengths, cost effectiveness. Current systems and processes are disconnected, which lead to a lack of operational efficiency. Weaknesses, changing medical devices technology. It's really important for them to keep up with the trends, and it's really hard and really expensive to keep trying to get the best high-tech equipment for the medical profession. Continuing expansion of medical device integration. Trying to get this new technology to integrate into the new systems and with the old is a really hard task. Increasing need to connect to personal devices to make sure the patients, to keep up with the patient's demands and make sure that they are at a constant intimate bond with the patient. It's important to be connected as possible through new apps and new devices. They have too many vendors. One of the problems with this is that they need to, with their EMR system, is they need to integrate into one single system rather than having 3 different ones that they currently do. Threats. Hacking patient information is always a threat that it looms, with cybersecurity being at the forefront of trying to defend against it. Opportunities for improvement. Timely direct communication between caregiving team, physicians, physical, case managers, nurses, and other support departments. Patient to nurse communication, alarms, beds, and pumps. Real-time nurse documentation. Improve adoption and consent application of experiences across the enterprise. Professional practice at bedside rounding service recovery.